Hey guys, welcome back to Tuesday Night Tips with Back to Health. My name is Dr. Alexander Detayev. I'm a physical therapist. So, I've been definitely hearing a lot of you kind of speak and let us know what you're thinking about these videos. And one of the things that we're hearing is, hey, get to the point quicker. Great content, but it's taking too long. So we're gonna try to keep this video a little bit shorter, see if you like it better. So we're gonna jump right into it. Today we're going to discuss tennis elbow, or the official term is lateral epicondylitis, which is basically pain in your elbow region. So you have two spots in the elbow that usually we get pain, and that's the outside of the elbow, which is known as the tennis elbow, or the inside, which is known as the golfer's elbow. And no, you don't have to be a tennis player to have tennis elbow. That's just basically when you're overusing your wrist extensor muscles, whether there's an imbalance in muscles or you're overusing it, you'll basically have some inflammation in this area, and that's known as the tennis elbow. I guess one of the reasons it's called a tennis elbow is because when you're playing tennis, the way you serve, you have to twist your hand in a particular way, and that does put a lot of pressure onto this region, which again, outside of the elbow, that's the tennis elbow, inside, that's the golfer's elbow. Okay, so some of the things that you could do for it when you have tennis elbow is you want to try to figure out where is the imbalance in the muscles. Usually one muscle is going to be weak, one muscle is going to be stronger, and then you have that uneven pull, therefore you get the pain. Obviously, once you have the pain, you want to try to avoid using the wrist extensors, so such as something like holding something in this particular motion, holding a briefcase, carrying things, holding things up in the air, because that requires, as you can see, the muscles pop up right here, requires the wrist extensors to work. You want to work more on your wrist flexors, because you are trying to get these muscles a little bit stronger. So this way, because if these muscles are weak, the extensors are going to have to compensate and overwork ultimately. So you try to balance out, get these muscles a little bit stronger, relax these muscles, let them rest. You can apply ice right here. You can take some medication, which obviously you have to talk to your physician about. And in terms of physical therapy, in terms of strength training, you also want to take a look, because a lot of the times when you have weakness in your shoulder, let's say your rotator cuff in particular, you're going to be overcompensating by using your distal muscles. So if my rotator cuff is strong, instead of my shoulder stabilizing me, it kind of releases forward, and my wrist extensions, whatever I'm holding, they have to work that much harder because my shoulder muscles are not working, putting a lot of strain. Like I'm feeling right now, already, just for like a second, I'm already feeling the burn. When my shoulder muscles are stabilized and I'm holding it, like pretty much no pain, I feel great. And that's one of the ways that you get a tennis elbow, and to avoid it, you do the opposite by, again, working on your shoulder muscles. I'll show you an exercise right here. So if you have like a band right here, you can get it on Amazon, pretty much anywhere. It's a regular TheraBand. Individual packets about $5 or so, $6, depending on the color. You want to start off with the lightest one, which is yellow. So one of the things is you can literally hook it right here, and you can do a couple of wrist flexions. As you can see, the muscles working right here. This will get my wrist flexors working to take the balance of the pressure of my wrist extensors. So that's going to be one of the exercises. In terms of getting your shoulder, so you can literally hook it against like a door, like any kind of doorknob. I'm going to stand right here, keep about a 90-degree angle, and bring it inside. That's where you're getting your rotator cuff, internal rotators. I'll use this hand just for the demonstration purposes. You can hook it right here, and you're going to do external rotators. Again, you want to try to keep your elbow close by so your rotator cuff is working. So this is kind of the few exercises that you could do to, again, get your strength in your shoulder, your wrist flexors, and you want to avoid using these muscles. You want to avoid carrying, lifting things, avoid extending your wrist, because that's going to put more pressure, and that's how you got the pain in the first place. Another thing that I recommend, so I just found this picture, and no particular reason, you don't have to get this particular brand, but something like this, if you could take a look, This is could be used for both tennis elbow and a golfer's elbow brace. So it has, like, if you take a look right here, so this is a basic strap, and right here you have like a little cushion or like a little bubble. So what you're gonna do is you're gonna find, if we're talking about tennis elbow, you're gonna find a little bone, like bony prominent right here. You're gonna take about an inch going down, and if you flex, you're gonna feel a muscle pop up. Take about an inch down, and you're gonna put the pad right here, and you're gonna strap it. And the purpose of that is whenever you have to use your wrist extensors, it's gonna change the mechanics of how your muscle works. So instead of pulling it from the tendon at the bone, it's gonna change the grip and the pull about an inch lower at basically at the muscle level. Changing the mechanics, taking the pressure off the tendon, and allowing it to heal. That's, again, nice and simple. If you like the content that we're sharing, again, if you like the time, hopefully this is nice and short, very right to the point. Please share this video, share with your friends. We are here to help. We are back to health. I apologize. So again, share, leave comments. Please leave comments. Give us more topics. I'm gonna give you a little sneak peek what's coming in the next couple of weeks. I'm not sure if it's gonna be next week, but we just got this table. This is the first time I'm seeing this, and it's pretty awesome stuff for scoliosis. So if you can just take a look right here. This is definitely, I don't think anybody has seen this type of table. I think it's custom made, and it's used to treat scoliosis. We have one of our therapists. He's great at scoliosis, and he's going to be doing this one of those videos in the near future. Definitely a lot of cool stuff. So I just wanted to share this with you because literally this just came in today. Anyways, share, leave comments. Thanks for watching. I'll see you next week.